Morning or afternoon, everyone. It's Luke Gage from Action Coach, and today we're on the Community Matters on behalf of Professional Liverpool. And today, my guest, really exciting guest, to be honest. I'm really pleased he's come on based on the current climate and what's going on in the world really right now, and especially affecting businesses in Liverpool. We've got Dr. Ed Lynch. Welcome to the session, Ed, and thanks so much for sharing your time. I know you're working pretty long hours now, managing both working in hospitals and your business. So yeah, thanks for sharing your time. So yeah, just to give everyone a bit of context about what we're going to be discussing today. Obviously, COVID's quite a big context, and Ed's just come off a COVID wing a couple of months ago now, was it? So I've got loads of questions, just myself personally, and I think there's a lot of questions that people will be interested in asking or finding out about as well. So we're going to cover that, talk a little bit about people working from home and workplace well-being and how that all fits in, and then also a bit about your business, Ed, and how what you've learned and transitioned into trying to give back and affect things. So first of all then, Ed, how long have you been a doctor for then?
It's been 15, 16 months now. So
yeah. And how's it been before? Obviously start your doctor's gig and then going straight into COVID. That must have been pretty intense or interesting.
Yeah, I was quite fortunate in what I started on. To be honest, I started on what's called a medical rotation. So typically you'd have 3 types of rotations. You'd have medicine, surgery, or community. A&E is kind of its own separate little thing, but they're main pathways. I was quite fortunate in the sense I started on a medical pathway. So they're really, really intense, and, you pick up a lot of skills. You are contracted so many hours a week, but it never happens. You're flat out.
Mm-hmm.
So yeah, I did a medical rotation, and then I was on surgery for about 6 months, and then I was placed on a COVID ward. So yeah, I mean, it was a lot of fun.
Cool. So how was it, obviously going on to the COVID ward, what was it like at the start, obviously when it all started kicking off, and I've got loads of questions about certain different nuances about it, about how, versus the flu, the masks, about what we can do to stay healthy. But what was it like when you first went on the wards then, please, Ed?
Yeah, so, well, we initially started seeing patients coming in through A&E. Right. That was where everyone was presenting to, and I remember the first cases coming across from Wuhan, and obviously we isolated and started quarantining them across in Arrow Park. So yeah. I think Liverpool, we were getting the first few cases in. We were trying to triage the patients as effectively as possible. So we would set lower risk wards, and then we'd have step ups. So we'd have like ITU. If somebody needed a ventilator and they're very, very unwell, they'd go straight to ITU. And then we'd have other wards where the patients weren't quite as unwell, but they still required quite a lot of medical attention. And then we had step down wards as well. So, the whole thing was triaged based on how well that patient was.
Yeah. I
was kind of sat right in the middle of that tree. I wasn't on ITU, and I wasn't quite on a step down ward. So with that, it was difficult because we didn't have the access to ventilators. Not all our patients weren't ventilated, but we could use other measures of keeping them alive. So we have oxygen delivery. We were trialing steroids, supportive care, breathing exercises, line them on the front, all kinds of things. And then, of course, managing the comorbidities alongside that. A lot of patients in hospital were actually in for a different reason, and then COVID as well. So I think the trust learned quite a lot about how to manage the COVID very early on. Of course, we've seen acute respiratory viruses before, but one that can spread so rapidly like this, the trust learned that actually we should make areas which are fully designated for COVID rather than trying to isolate them across the hospital, put them all into one area if possible.
Yeah.
Because then that changes how the staff can actually approach the patients. One of the first issues that we had was a lack of PPE, but also using the PPE that we did have inappropriately. I'll give you an example. So let's say we have a patient in bed 15 down the way, when we go, and everyone else on this ward is negative, but he's a positive. So we go into that bed space, put the PPE on. As soon as you leave that room, or just as you're about to leave that room, you get rid of all that PPE so that you're not transferring it across the board. And you think initially, makes sense.
Yeah.
However, what that meant was, when you're doing that so many times a day and the staff members in and out, you are going through that PPE so fast.
Yeah.
So
and must be knacking as well, taking it off, or just like taking so much time as well, and just
time consuming.
Yeah.
Very. So a 5-minute job would take you 10, 15 minutes.
Yeah.
But what we started doing then was, if you have a look at PPE, it's got a lifetime. So it's got like, this mask survives 3 hours, or this mask survives 6 hours. So then we started incorporating sessional use of PPE, which made it much more effective in terms of allocation of PPE. So yeah, I mean, the trust was constantly trying to learn through the experience and how we could make it better for the patients and for the staff. But, you know, it all happened so quickly that we were very underprepared.
Yeah. Were you getting, so obviously I know trust works, that'll be, for people who don't know, a trust would have a numerous amount of hospitals in a sort of local area, like it'd be a trust. So you might have 2 or 3 or 4 or 5 or hospitals that are all part of that same trust, all run by a body or an organization or board. So was there like different things going on in different trusts then? So you would figure out something, and then we're going to do it this way, or figuring out this, and then another trust might have been doing something totally different based on their learnings. And was the directive coming down, this is the way to do it, or were you sort of given a bit, it's down to that trust to decide how they want to operate things?
Yeah. So this issue becomes so complex. I think because the government, they were unfortunately quite slow to act and implement change. The trust had to then take on decisions themselves to safeguard their staff. And, the trust weren't entirely sure what was, because you follow national guidance is what you do. We always look at the national guidance, and that's what we stem our practice from. But that national guidance wasn't being released quick enough. And if it was being released, it was non-specific. So,
and just guidance, not directive.
Yeah. So the trust, we started creating our own policies, and the medical director would come down to the doctor's room and ask for our feedback, what problems we had on the ward, how can we improve, and it was constant feedback loops trying to improve. One of the first things we implemented was how to actually take a swab properly. The staff hadn't been trained how to take a COVID swab appropriately, for example.
Yeah.
And that's going trust wide. We've got to train the staff effectively.
Because you might, I know people who are friends who are nurses or training nurses, taking blood, they might practice that for 12 months, 18, before they get qualified at that. Right, you need to do this today, with very little training, which is fascinating. Okay, so I'm going to hit you with a couple of juicy questions right now, because I think they're interesting. Right, there's a lot of people that think COVID's not real, not as bad as the flu. There's so much stuff out there. You read them on the news, then Sally or Jeff from this area posts something on Instagram. What's your thoughts on that in terms of the severity of the virus and its spreading?
Yeah, big question, Luke. Okay, there's so many things we've got to touch on here. Look, it's an acute, severe respiratory virus.
Yeah.
The way it differs from the flu, well, the flu is what's called influenza virus. So it's a separate type of virus. Coronavirus is COVID-19 is a coronavirus. You've got rhinoviruses, you've got, what's the one that causes? Adenovirus. Adenovirus causes the common cold. So there's all these different types of viruses. Influenza in England isn't that serious in the sense that we have a vaccine. Every single year, we look at what happens in Australia, because for whatever reason, Australia are always first to get the flu every year. So we look at what happens in Australia, and we map out the genetics of that virus, and then we produce a vaccine on that.
Yeah.
And I mean, influenza is the biggest virus killer, pretty much, respiratory virus in the world every year. And it kills, I can't remember the exact stat, but it's around 500,000 a year, something like that. It's huge. But we're talking about third world countries here, which don't have access to a vaccine as readily as we do. So in the UK, we should all be getting the flu vaccine, especially now that COVID's on the rise. I can't urge everyone enough to get the flu vaccine this year.
Yeah.
That would be my first bit of advice.
Can I just pick up on that point then, just before we crack on with that? So what's the reason for them, like you hitting home about them getting the flu vaccine? How does that benefit you or the NHS or us, or why?
Yeah, okay. So there's something called herd immunity. So depending on how many people are protected against the disease, it has a lesser chance of spreading across that community. So if we can safeguard as many individuals as possible, it then can't just go viral and spread.
That's with the flu, yeah?
That's with the flu vaccine, yeah.
Yeah. And the benefit of it not spreading then is what?
Well, you don't get the flu. And then also you don't get a combined infection. You were not going to get, the problem is if you get a lung infection, if you get infected by pneumonia or the flu or COVID, your lung function will be affected by that. You know, we get scarring, internal scarring within the lung, and it's not great for your lungs. Then if you get back-to-back infections, if you've just had the flu and then you get COVID and then you get pneumonia, you know, it's lights out for a lot of people.
Yeah.
So
Yeah, that makes sense. No, I was just trying to like hit home about what's the reason for that, but it makes sense. Obviously, you don't have back-to-back viruses, you don't want them both at the same time, and also like just get the vaccine if you've got a vaccine. You know, it makes like in 3 years' time, so get the COVID vaccine at the beginning of the year because it's just makes sense. All right, so go on.
So people don't like vaccines because they think it gives them the disease. The way vaccines work is you take the different parts of the virus you're trying to create immunity against. You take part of that, you make sure it can't reproduce essentially, and then you put it into somebody's body. What happens then is your body will produce an immune response to that being inside you. So you will feel unwell. But the only reason you feel unwell is because that's your body's response to the virus. It's not actually replicating massively in the body. So, you know, you'll get a blocked nose because what your body does is it blocks that, so no more stuff can get in.
Mm-hmm.
You know, it'll raise the temperature within the body because a high temperature in the body kills off viruses as well.
Yeah.
All of these things that happen internally are to fight off that infection. So your body does think there's an infection there, but then what happens is it creates a load of antibodies, kills off this infection, which can't actually replicate.
Mm-hmm.
But then because you've got the antibodies, you produce what are called memory cells. So say if you do then get infected with the flu properly, you know, not a vaccine, but this is a live actual disease here, you then get infected with it, your body knows, oh, we've seen this before. And then it's got all of the defense mechanisms required to kill it off straight away.
Yeah. So going back to, is COVID worse than flu, or how serious is it then? We were just touching on the difference between flu and how there's a vaccine for it. So just picking that question up again. Is it worse? Is it not as worse? Should we be worrying about it? Should we not be worrying about it? You know.
Yeah, I think we should certainly be worried about COVID. We don't know how it's going to affect individual people. You know, the average age of a person who gets COVID is 76, and it does affect men more than women. Over 60% of cases are men. But it is a really serious disease. I can't say which one's more severe, flu or COVID. What I can tell you is that, yes, I've seen lots and lots of people die because of COVID, and they are of no particular background. You know, I've seen a 23-year-old dude with no comorbidities at all, and he's unfortunately died due to COVID. So I would say, let's just be safe. It's real, it's out there, and it's harmful. So let's play it safe.
Yeah. And you said there's you've got no idea of how it's going to affect different people. So, because I think there's a lot of people out there that think, well, I'm young,
Mm.
healthy, female. I know getting more than males.
Yeah.
And then obviously older people, there's they're at severe difficulties. Then you've got the health conditions as well. I know that's a bit of a problem as well. If you're more prone to health conditions, that makes sense.
Mm-hmm.
But there is a chance that it might affect you in a severe way. You don't
Yeah.
know.
I mean, the percentages are, from the data that we have, it is very small. So if you're aged 20 to 35, it is really, really minute chance of it causing a serious disease. But equally, you just don't know. You know, that the young lad that got it, he probably thought, oh, it'll be fine. So what I saw, I read a statistic the other day, is you are more likely in our age group, 20 to 35, to be killed in a car crash statistically. But equally, it wouldn't mean that you just go driving recklessly. You still follow the rules that are put in place. You know, we all follow rules. It's
Yeah,
not like, oh well, those are the risks, so I'll just go wild. It's like, no, hang on, you've got a lot of things within your control to actually stop you from getting the virus. So why don't we just do that?
yeah. So that leads us into some of the government restrictions and where we are with things like that. One of probably the annoying things that I hear is like, well, I'm 30-year-old male, I'm fit and healthy, it's not going to affect me, so I'm not going to, abide by some of the guidelines or not that bothered. That's probably the big thing that annoys me the most, because you don't know, well, you might pass it to your nan,
Yeah,
or go and, you might go shopping, then touch a
yeah.
metal service, then somebody who's innocently going behind you and passes it. What's your thoughts about that?
Yeah, I think it's massively irresponsible. I can't conceive the mind of a person who would be so ignorant to the rest of society. I just think it's horrible.
Mm-hmm.
Uh, as you've mentioned, somebody's nan might try and go to the shops, and obviously they're a lot more predisposed to getting a severe infection. So it's like, please have some respect for each other and take it seriously. Wash your hands, and in a supermarket, wear a mask.
Yeah. So going on to some of the specifics then, in terms of some of the things that are put in place, then the mask then, as people say, well, how does that, does it work, does work? Why, yeah, what's your thoughts on that?
Yeah. So
And how does it work? Or have you got any thoughts on that?
yeah, so we actually need to look at the problem itself. How is COVID spreading? So there's two forms of transmission. Have we got webcam on, or is it just voice?
It's webcam, yeah. Video and audio, yeah.
Yeah. So you've got two forms of transmission. You've got, over this side, you've got what we call droplet transmission, and over here you've got airborne. So droplet transmission is, it depends on the particle size, whether it's going to, if you think about a water droplet in the air, if it's big enough, it will drop to the floor because it's heavy. If that droplet is tiny, it will float in the air. You know, if you sprayed like a deodorant can,
Yeah, yeah.
all of those particles float in the air, okay? The main form of transmission for COVID is droplet form. So it's water particles that are going to be dropped to the floor. So if you think coughing, sneezing, talking, singing, that's all going to be producing these water droplets in the air that are going to drop onto surfaces. And that can last anywhere up to about 100 hours, which is why if you're touching surfaces, you don't know who's been in that area. It depends on the surface.
Yeah.
Metal's around 72 hours, cardboard's about a day. So it depends on the surface that it lands on. But most of the transmission of COVID is droplet. So, you don't know what you're touching. You don't know who's been in that area. So that's why we say wash your hands, because you touch your face over 300, 400 times a day. So, and you do it unconsciously as well. Just if you kept a diary of it, it would be huge. So that's why we say wash your hands. Now, for droplet transmission, what you need is a waterproof mask to stop those droplets from passing through the mask. So I'm going to get in trouble for saying this, but there's no evidence that I have found anywhere that suggests a cotton mask is of any use, because it's not waterproof. You need a waterproof membrane within that mask. It doesn't have to be a tight fit. All we're trying to do is catch those droplets. So a waterproof membrane over the front of the mouth to stop those droplets from coming out. Okay. So that will stop the main form of transmission of COVID, and that's anywhere between 90 and 95%.
Yeah.
The airborne transmission, this is much, much rarer to get it. And actually, if there's floating particles in the air of COVID, the chance of you getting that actually as an infection is low again. So the transmission of that, we don't know. That is more apparent in like enclosed areas with poor circulation, poor air circulation. So if you think like the London Tube, or if you're in ICU, where they're blowing all of the COVID particles into the air, that's where you need a really tight fitting mask. Typically, you're not going to be in those situations, which is why we're saying to the public, wear the non-tight fitting masks. What I would say is make sure it's waterproof.
Mm-hmm. Yeah. I guess, like you say, if you just walk in, if it's like in the open air or in an open office, then the airborne chances of going in is very limited. But like you say, if you're on like tight fitted or they're airborne, they're going to keep going past you, and then there is obviously a chance. And my thoughts on it is obviously if I've got a mask on, I'm probably protecting other people as probably more or as well as myself, and I do think that it will stop it a little bit. But I agree with what a cotton mask is better than no mask, isn't it? Because it's going to stop some of the water droplets. But I 100% agree that water is going to come through that mask or go in.
Yeah.
Okay. What about?
Yeah. Go on. Sorry.
What about sunlight then? So the same, we can do stuff outside. I've heard stuff out there that UV rays kills it instantly or doesn't kill it instantly. What's the thoughts on that?
So there's a difference between what's called a correlation and a causation. So I'm sure that there's some kind of correlation between UV light and a reduction of COVID particles. There probably is. There's probably a correlation between what time you wake up and how successful your life is. I don't know, but whether or not it's a direct cause, I haven't seen anything out there which would suggest that. So look, we have more effective measures than to worry about, let's blast it with UV, or as Donald Trump say, inject bleach into our veins. Let's just keep it simple with what we understand.
Yeah. I meant more if I'm outside, I'm out in the sunlight, is that going to kill stuff on surfaces? So I'm less likely to contract it if I'm out in the park, touch a park bench.
I see what you mean. Yeah. I mean, like I said, I haven't read all of the studies about UV, so it's difficult for me to say. But if that's what the reports are saying, then yes, that would make sense. But then you haven't got the airborne transmission there as well.
Yeah.
So.
Cool. Next question then is around vitamins and exercise and health. Because I've also heard stuff around like, how does that affect things in terms of vitamin D and exercise and stuff like that. So what's your thoughts on that?
Okay, so I don't know, again, I don't know exact cause between your vitamin D levels in your blood and how secure you are against COVID. What I do know is this: every single patient I've seen in the past 4 months is vitamin D deficient, and that is our lifestyle in the UK. We typically wear clothes all of the time. We're normally inside, and we're not getting the UV light that would be required to synthesize the vitamin D particles in the body. So pretty much everyone in hospital now, I put on vitamin D supplementation. I take vitamin D every single morning, but that is more for health benefits rather than this is going to cure COVID. Yeah. So what was your other question alongside that? Health.
Yeah, well, I think just because on the vitamin D, because I've read a lot about that, and so your advice is not to start taking it to reduce your chance of getting it or fighting it off until you get it, or would your advice be to start taking vitamin D now?
Well, I would say if you want advice, of course, go to your GP. I can't be advising people who aren't my patients legally. But what I would say is I take vitamin D because I know that due to the lifestyle that we live, we typically have deficient levels of vitamin D in the blood. Yeah. So don't even take COVID into the equation here, because we're trying to fight the virus off here. People aren't doing studies about vitamin D levels and how effective it is against stopping COVID. So we just don't have the data on it yet. So if you want to take vitamin D, that's great, but do it for your general health, not fighting COVID.
Yeah. And then next one's around exercise and things like that. So how does that help?
Yeah. So, I mean, generally staying fit and healthy is of course very good for you. If you're doing aerobic exercise, it's not only good for your heart muscle, but it's great for your lung function as well. So you've got something called elastin in the lungs. It's a little particle which keeps your lungs stretchy. One of the worst things you can do for breaking that down is smoke. So if you are a smoker, please stop, especially with COVID flying around. It really breaks down all that the elastin particles within, or the molecules in the lungs, and increases your proclivity to get COVID or make the infection worse. But generally staying fit and healthy, doing some aerobic exercise, doing strength training, having a good diet, not only does it have massive benefits for your mental health, but your physical health as well. It's not going to stop you from getting an infection. That's where your PPE comes in. But say if you then become infected, it's going to give you a better chance of fighting it off.
Yeah. Okay, then. I've probably asked all the questions that I was sort of like interested in or thinking about from a health perspective, physical health perspective. How have you seen things being affected from a mental health perspective then over this time? Public, NHS, other works as well. What's your thoughts on that?
Yeah, again, big topic, Luke. You hit me with some massive ones tonight. So I think let's touch on patients first. It's been really, really difficult for patients and their families, because say if a patient has COVID in hospital, they've got to isolate in their rooms. They can't come out of the rooms. They can't wander around the ward. These rooms aren't big. It's got a bed, and if you're lucky, like it's got an ensuite on it. So it's not a nice room. It's all washable floors, and the impact on the patients, it's a really restrictive thing, and we need freedom as humans. We like to take control of our environment, and if you've got COVID and you have to isolate in that setting, it's really unpleasant.
Mm-hmm.
Let's compound that with the fact that I now can't see my friends and family members. Visiting in hospitals massively reduced, and unless they're on death's door and dressed head to toe in PPE, we're not letting people in. So that again is going to play a big part on the mental health of the patient. The impacts on the family, as we've just discussed, they potentially don't get to see a dying member of their family. We like to have dignified deaths where everything's idyllic and perfect, but COVID's made that really, really difficult, and especially when it is potentially the last time you're going to see a family member, it's an awful, awful situation.
Yeah.
The staff who were nursing the patients, there was a lot. The nurses on my ward were very scared at the start, especially when they started seeing other nurses very unwell. So the nurses were nursing the nurses who were very unwell with COVID. And there was still a lot of ambiguity around the PPE at the time. So, that was very stressful for staff. And then some would go off with anxiety, PTSD, stress. So it was an awful time. People either self-isolating with COVID, or they were off with mental health issues, or they were off minding the kids, and our workforce was massively diminished. So
because that one week you could be doing a customer as a nurse, a patient. Next week you could be in there being a patient, somebody looking after you. You recover. Week after, the person who's looking after you, could you be looking after them?
Yeah.
Right. Bloody mess.
Yeah, it was. It was not pleasant at all. But I mean, unfortunately, we lost a few staff members at our trust, and that didn't make the situation any better for our staff members. And it does make me think that it would have been nice if the country could have prepared slightly better. When we saw the severity of what was going on in China, we should have thought at that point, this has the proclivity to spread everywhere quickly. And then in Italy, that was a second case of you thought, oh, hang on. But we still did nothing. So when you see the impact, the real life impact that it's had, I can't help but think, what a mess.
Yeah. So what about to people from working from home then? Because are you COVID ward, you're on a psychiatric ward, but I guess you still see people with, or hear or getting instruction or direction, people with mental health challenges, and around the trust. So how have you found that then? Because I think there's a lot of people who say that obviously you've got the deaths with directly relating to COVID, but there's probably going to be a lot of other illnesses and deaths that are indirectly related to COVID at the moment.
Yeah. So I've recently, about 2 months ago, no, 7 weeks ago, started on an inpatient psychiatric unit, and a few of our patients have actually come in with PTSD and stress and decline of mental health due to COVID issues.
Mm-hmm.
And it, a lot of people have a lot of underlying mental health conditions,
Mm-hmm.
undiagnosed. I don't necessarily agree with labeling or diagnosing certain things, but there's a lot of if you imagine like an iceberg, what we see is just the tip. There's a lot of stuff under the water.
Yeah. I wish that I've got a gripe on that, to be honest. I wish they would call it same as your physical fitness. I would just wish they call it mental fitness, and people are on a scale of how fit they are mentally. That can go up or down depending on diet, depending on if you've had something traumatic, sad, which is going to come out, in terms of the with the days getting shorter. I wish it'd just be, your physical fitness and your mental fitness, and not have that stigma around it, because I think then more people get help, number one. Number two, I think you can be more directive, because there's lots of things that you can do to improve your mental fitness: exercise, diet, water, not smoking, drinking, coffee, all of them things. So could be a grab against that, to be honest.
No, you've hit the nail on the head, and I think people's mental health change not only on a minute by minute basis, and it does. If you're interested in this, your current, I can't call it mood because it's not a mood. Your current feelings is what we call affect. So if you want to Google this, it's called your affect. So how you feel right now is your affect. How you feel over a period of time, a short period of time, is your mood. Yeah. So if we take like a geological example of this, the weather outside right now is the affect, your affect. So if it's raining, that would be the affect. The climate, the general climate would be your mood.
Yeah.
So yeah, I mean, we have specific terms for how quickly people's mental health can change, and that just shows you that, like, it's as you pointed out, you'll sit somewhere on this scale, and you're constantly flowing up and down the scale, minute by minute, hour by hour, week by week, and it's just not appropriate to go, you have this, and that is you now. That's just, it's like, well, it changes, It's
almost like, because that's the challenge. It's almost like binary at the moment. It's either you've got it or you have, that sort of mental health. It's like, all right, it's all or nothing. Oh, but what's going to happen? This, that, and the other. I just wish we'd change the term to mental fitness, and then give a directive. And you might be, out of 10, 10's high. I'm at a 2 today, or a 3 today, or been a 4 for 6 weeks, or I was a 7. And now I feel that, and I guess the other thing, everything's subjective as well, right? Because everything's in the eye of the beholder. That scale is different for other people. People might have different tolerances, or different. A 10 for some people might be a 4 for others.
Yeah, exactly. It's interesting you say that. When we assess patients' mental health, we do what's called a mental state examination. And as you've just touched on there, we look at their subjective mental health and their objective mental health. So seeing if what they say and what they say they're experiencing is in concordance with what we see as well. So like you say, it is a dynamic relationship.
Yeah. And I know that this is quite an interesting topic for you, because I don't know, it was last year or the year before that you started a business called LYFE, which is aimed at impacting and supporting mental health and workplace well-being and all that. So when did you start that, and how did it come about, and what's the purpose of it?
Yeah, so it was October last year, so October 19, we actually registered the company.
Yeah.
I mean, it all started. I'll give you the short version. I was kicked out of medical school in my 4th year. I just finished all of my exams. and then my final exams, and then flew off to Mongolia to do another part of the course. So I was doing some like wilderness medicine, and I kid you not, my form of transport was actually a horse, like a genuine horse.
What was it called?
I called it Tesco because the meat scandal just came out. So yeah.
Tesco the horse. You're on Tesco the horse in
In the middle of Mongolia, and I got my exam results through hotspotting of somebody else's SIM card because he was the only one that could get signal.
Yeah.
We didn't have running water or electricity, never mind Wi-Fi, So I found out that I'd failed one of my exams, and I thought, oh, this is well, firstly annoying, but strange because it was a practical exam, and that was always my best exam. So anyway, I tried to appeal it, but apparently I didn't appeal it in time. But I was out in Mongolia. I'll cut a really long story short, but I couldn't communicate effectively with the university, and I got kicked out. So I was out of uni for about 7 to 8 months, and I noticed a huge decline in my own mental health. Everything I understood about my own life and where I was heading to, my trajectory, was literally just thrown in the bin. And it was like, well, that's it now. There's no student support because you're out of uni, just being like, you're on your own. So I was like, didn't know what to do with myself, really. Luckily, the girl I was seeing at the time was training to be a barrister. So she taught me how to represent myself. So I represented myself in the hearings, and it went to what's called Senate, and it all got overturned. They were like, yeah, you've got a valid case, and it was a big mess up by the uni. Got myself back into uni, passed the exams, it was all grand, and then that summer, during that period, because I got a decline in my mental health, I was looking at ways to safeguard my mental health, and actually there wasn't a lot out there. It was like, we'll go download the Headspace app or do some deep breathing. And I was like, you need something more holistic and more complete than that. So I thought that was my first inkling that there's something wrong there. Then that summer, one of my friends from school, he killed himself. So with those two events compounded, I just thought, look, I've got to try and
sort it out.
Yeah. Which is where I didn't know it was going to happen, but this is where I started thinking, what can I do? So I approached Blue Coat School, my school, and said, can I put on an assembly for your sixth form students moving to university to safeguard, or to try and make them aware of the services available to them, and just because that's a high risk period of their life, what can I do to help out as much as possible? And it went down really well. So it just snowballed from there. We were soon doing sessions for the teachers. I was teaching my own teachers. It was all very bizarre. And then it snowballed from there. So we started doing some corporate stuff, and then that's where LYFE came from.
So what products and services does it provide now then, the business LYFE? What support does it do?
So we do corporate wellbeing days.
Right.
All of our interventions, all of our underpinning ethos is based on medical evidence. So we do complete health wellbeing days. To optimize mental health, we have to optimize the individual's complete health, and that's what we do. Everything we do is based on 40, 50 years worth of research. It's the most prominent research out there.
What type of things you do in those days then?
The sessions.
Yeah.
What we actually do, we find out the needs of the company. So everyone has slightly different needs. So if they've got a lot of anxiety within the workplace, we'll do sessions on anxiety. If there's a lot of stress there, we'll work on stress. If they need some smoking cessation advice, we'll do that. If it's just general motivation or general well-being or lifestyle advice, or literally it's tailored to the needs of the company. And it's not, we can split it up into half an hour sessions, hour sessions, half days. But I think where the real impact of what LYFE does comes in is if you couple that service with the platform that we've got.
Yeah.
The LYFE platform incentivizes and motivates the team, your employees and people, to live a healthier lifestyle. And it does so by making that access to a healthy lifestyle so easy that you don't even need to think about it. And then it financially incentivizes you to do it as well. So
what do you mean by that then? So you've got this platform. So let's say I'm an employer. I've got 100 staff. I want to do good for my staff, or I'm in an industry that's pretty stressful, or I just think it's just something that I want to do because it's the right thing to do. Might get you doing a couple of workshops, days and stuff, but then I would get all of the my employees to download this app. So employees got this app, this platform. How does that help them like live a healthier lifestyle or things like that? How does that work?
Yeah, so I think initially one of the big things is actually educating the person about what it is they need to do to be healthy, because the amount of misinformation that we read online is vast. And you'll read something on healthline.com or livestrong.com about the absolute importance that you take a certain type of kale or something, and you're like, oh, you've got to have this kale and it'll change your life. It's like, will you please get a grip?
Mm-hmm.
So what we do is we make people realize it's actually really simple, and the things that we educate about, that you will probably know most of it, but it's making a proper schedule and routine around those things that they can engage with that lifestyle much more easily. So you start with the education, and then you give them the access to that resource permanently. So, for example, let's say you're at work, you've forgotten your lunch, you haven't been organized, you've forgotten your lunch. What's around me that is now healthy? Oh, I don't know. Well, what you do is you'd open up the LYFE platform, you'd open up the LYFE app, and it will tell you everything around you which is healthy to eat. And it'll break down calories, high protein, if you want gluten free, whatever. It's all on there for you. So whatever your dietary needs are. And it's all been vetted by us. So nothing on the platform can get on that isn't healthy.
Yeah. So would that be, so there might be 5 or 6 different categories. So one might be exercise, sleep, diet, local, like, yeah, on the platform.
Yep. So there's 8 categories.
Yeah.
We've coined the term core life elements. So you've got 8 core life elements. And again, they're all based on research that we've done. It started off with George Engel, an American psychologist in 1978. Really interesting guy if you want to go read about him.
Mm-hmm.
All stemmed from that research called the biopsychosocial model. So we've got these 8 key categories. Like you said, diet, we've got fitness, we've got building strong relationships. Harvard University actually did a study starting just before World War II finished, studying what predicted life success and life satisfaction across these people from all these different backgrounds. And the single biggest predictor of how happy you were at the end of your life was how strong your relationships were. Really interesting study. I'd recommend everybody reads it if you can. So we've got diet, fitness, relationships, engaging with nature, mindfulness. All of the 8 sections are in there within the app. And then you click into it. It's location based, so you can see what's around you. It's review based, and you just go on there and you get a discount to go and do it. So
we might say, go to this park or this area, go for this food. And then there's also monetary benefits. So the local, not local shop, but some of these shops around there will give you a discount code, or there'll be offers and things like that. They would come through as a push thing. That's really, really interesting. So what...
And you're supporting local business.
Yeah, good. Which we all bloody need right now. So, and where do you see LYFE's 5-year plan, and how does that align with where you see the health sector going then?
Okay. I think we are moving to a paradigm where generally in health, everything's going to be much more prevention focused. Treatments are so expensive. One surgery might cost the NHS £150,000. We could take that money and put it into health promotion strategies.
Yeah.
And cut down smoking cessation, for example. It's a much more cheap, effective way of making the population healthy. And if that person's healthier as well, they can contribute more to society. So you get into this cycle where it's beneficial for so many more people to
be
focus
healthy
on prevention.
Yeah. And I guess touching on what we said about the 2 continuums, they're both related, aren't they? Physical health and mental health. And they're almost both intertwined. The better mental fitness you've got, the better, more chance likely are you to keep mentally fit. The more mentally fit you are, the more likely you are to keep physically fit. And then you've got, coupled with both of them, you've got your ability to deal with COVID or these challenges on a mental level, then also your ability to deal with these on a physical level. So they're both intertwined and both massively important. So I guess your directive is like focus on both. Then, or if there's anything you can do, is just focus on both them areas: physical fitness
Yeah.
and mental fitness.
Yeah, I think as well, we are social animals. We do have to socialize. That is one of the key categories. We talked about George Engel, the biopsychosocial model. Social health makes a huge component of being healthy individuals. We are tribes people, if you think back to how we're derived. So I know it's difficult with COVID because things are virtual and it's nowhere near as personal, is it? You don't have that physical connection with people as much, but we do need to try and socialize and get out of the house, which is why I know the government have said work from home if possible. I would say be safe and go to work if possible. If you're socially distanced and you're being safe along the way, PPE, if used correctly, does work.
Yeah.
So you can go to work, be productive, and be safe, and you're keeping that social side of your health safeguarded.
Yeah, I guess the challenge of that though, if you public transport, it's just can be dangerous, isn't it? But if you've got, if you can get the car and your office is doing, well and social distancing, then go in. Totally agree. Last question then, before we sort of wrap up, or if you've got anything you want to share, just had me thinking about social. What's your thoughts on? I don't know if there's any research on this, but you say you need to be social and meet people. Does Zoom work? Is that the same? Phone calls, FaceTimes, WhatsApp, is that being social with people, or do you think it needs to be not socially distanced but in person contact?
I think, yeah. For me, it's funny actually. I wrote a letter to my consultant today about this exact issue, and this gets a bit spiritual actually, because one of the key things for me about meeting somebody in person is you pick up on their energy. The energy in the room is set, because it's set by so many factors around you. If somebody's over there and they're in a really hyped up state, you will pick that up
100%.
because and you don't get that through Zoom. So when somebody socializes, you typically bounce off each other and you can become very positive and have fun. You're also then doing an activity. You might be playing golf, you might be taking a walk through the park or whatever. Through Zoom, sat in front of Pizza Tech,
eating or drinking, coffee or snacks or cookies. That's a bit like the cause and effect type thing. There's no direct correlation, but obviously if you're out walking around meeting people in the sun or doing something social, then it's going to benefit you massively.
Yeah.
Awesome. Look, they're sort of my questions, and but have you got anything you want to sort of add or summarize on before we wrap up?
I would just say, if I don't know who's listening to this, but we can be safe and still get on with our daily lives. We can be safe. There's so many things that we can control as individuals that will ensure the safety of the public. So please take it on yourself to harbour that responsibility, not only for your health, but for the respect of the people around you.
Yeah.
We can make society work, and it isn't too difficult. That is pretty much what I'd say.
Yeah. So you're saying be safe, follow the guidelines, but also make sure you are doing the things that are going to support your mental and physical fitness.
Yeah. Yeah, exactly. And we know what works. We know how to stay safe now. We know how to use PPE. We know how to socially distance. Whether or not the government implements these guidelines or not, just use some common sense. Like, don't go around snogging people. It's not difficult to leave a little bit of a gap and just be sensible. So stay ahead of the game and safeguard yourself and your family.
Cool. So just to wrap up then, Ed, if people want to get in touch with you about the app or getting you into their workplace, probably a lot of business owners listen to this based in the Liverpool City region, what's the best place for them to contact you directly, or if they've got any questions about anything you've said, what's the best place to get in touch?
So I think I am on Professional Liverpool's website. You can get me through there. On LinkedIn, if you want to get me on that, I'm down as Dr. Edward Lynch. And also my email address is edward.lynch@thelifeclub.co.uk. The word life is spelled with a Y, not an I. So it's edward.lynch@thelifeclub.co.uk.
Yeah, LYFE. Yeah.
That's the one.
Awesome. Look, thanks.
At the end. Did
Yeah.
you
Pardon?
hear me lose my voice then?
Oh no, is it just gone? Well, perfect timing. Okay. Look, thank you so much for coming on the session today, Ed. I've really enjoyed it. It's been an interesting take on the usual PL Community Matters live. Thanks so much for the work you're doing in NHS and the work and really cool stuff that you're doing with the with the Live Club. I think that's fascinating and making people easier to be healthier, fitter and happier, really, which is awesome. So thanks so much.
Yeah,
Over and out. Speak to you soon.